We're talking about the um, pathophysiology of leprosy. Okay, and in talking about pathophysiology of leprosy, it's basically like you talking about the two different types of leprosy. That's the word lepromatous leprosy and the tuberculoid leprosies. Okay, how this disease condition basically come to be. All right, you know that leprosy you can get it directly from the microorganism, or it could be that okay, the microorganism spread from patient to patient. Okay, so now let's talk about the pathogenesis of this disease condition. This should be definitely a lepromatous leprosy because the face is looking like that of a lion, and that's what they call the leonine farcy. All right. So now, guys, the exact mode of transmission from patient to patient is not known. Okay, but what we'll be talking about is well, yes, we'll be focusing more on the organism. Okay, how it enters your body and all that. Okay. So the possible routes of entry of the organism may be through small skin abrasion, body contact, bites by insect vectors, or droplet spread via the respiratory tract. Okay. So now the T helper cells determine whether a patient will have what a tuberculoid leprosy or a lepromatous type of leprosy. You know, when we're talking about the different types of leprosy, we said that there's a type called the borderline leprosy. And this borderline leprosy can lead to tuberculoid leprosy or lepromatous leprosy. So for you to have any of this type, it depends on your T helper cell. Okay. So let's move. Now I'm talking about the TL, that's what the tuberculoid leprosy. Pay attention. Now patients with what tuberculoid leprosy have the helper CD4 and CD8 cytotoxic cells in the ratio of what 2 to 1 respectively. Okay. So and this type of patients will have what a type 1 hypersensitivity response with the production of what interleukins 2 and the interferon um, gamma. Okay, so now the interferon gamma is critical in mobilizing an effector host macrophage. Okay, so now the interleukin 12 produced by the what antigen presenting cells is important in generating the type 1 hypersensitivity reaction that patients with tuberculosis leprosis will have. Okay, so now low levels of this interleukin 12 or unresponsiveness of the T cells to this cytokine will reduce the type 1 hypersensitivity response, leading to a lepromatous leprosy. Okay, so now for this tuberculosis leprosy, um, the interleukin 12 are supposed to be produced, okay, and you're supposed to have a type 1 hypersensitivity reaction. That's why in the tuberculosis leprosy, the damages are kind of like mild, okay. So now moving to the lepromatous leprosy now. The lepromatous leprosy, the patient has what a defective what type 1 hypersensitivity response or a dormant type 2 hypersensitivity response. Okay, so that means the CD8 cells are more than the CD4 cells. All right, here the CD4 cells were more than the CD8 cells. Okay, so now it will lead to the production of what interleukin 4, interleukin 5, and interleukin 10, and these may suppress what macrophage activation in response to the Mycobacterium leprae. Right, so antibodies are also produced against what Mycobacterium leprae antigens, not usually protective, but form immune complexes with free antigens that can lead to what erythema nodosum, vasculitis, and what glomerulonephritis. Okay, so on the basis of that, that's just how simple the pathogenesis of what tuberculoid leprosy and um, lepromatous leprosy is. Okay, it's just simple with some few differences and all that. Okay, so see you guys in the next lecture.